Hi, I'm Dr. Eck. I'm a comprehensively trained general dentist. So today's question is about someone who's pregnant. Is there anything that they need to worry about pregnancy affecting their dental health? And there are quite a few things that you need to be very careful about. I would say the biggest things that I see a pregnant patient dealing with is when they've got that 9 months they have to prepare for and be dealing with the most important things, plus that 3 months after they have the baby, they're really occupied with that. So the biggest thing that people run into is their dental health deteriorating and not getting checked up on. So when can you actually come in and talk to a dentist about your dental health as a pregnant person? You could come anytime. If there's any tooth that you're worried about, it's best to get it looked at right away rather than waiting until it causes a problem. What kind of x-rays can you get? That does depend. Usually we are going to recommend that if we can hold off, we don't do it during that first trimester. That's just a recommendation from the radiologists. But what we can do is look at that tooth. When you're in the pregnancy, the kind of oral health care that you need to be concerned about doesn't change from when you were not pregnant. But you do need to remember that you're at higher risk during the pregnancy. Just with the factors we talked about, your changes in your eating habits and in the gums, there's going to be a need for more hygiene care, more careful flossing and brushing. That's really what it comes down to, is good flossing, good brushing, and watching the way that you intake sugar. And then you can keep your oral health the same before and after pregnancy. But the pregnancy actually will cause you to have some more difficulties in your oral care and oral health. You're going to be distracted, for one thing, but in addition to that, your gum health becomes much more inflamed. You're going to see a lot puffier gums, a lot more bleeding. The good news is there are very, very rare instances where it actually causes permanent problems. But during your pregnancy, you will experience more bleeding and more puffiness in the gums. What you need to remember when you're pregnant is that the better you can take care of your gums and keep them clean, the less bleeding and puffiness you will get in the gums, and you're going to protect yourself from being those few who do experience permanent bone loss around the teeth if you keep them very clean. Let's say there is an emergency that arises during your pregnancy. A tooth starts hurting you. That's happened before. I knew a patient, let's just call her Maria. She came into the dental clinic with a lot of pain, and she was in her last trimester, last month of her last trimester with the pregnancy. And it was so much pain that I looked at it and thought, there's no way that this patient is going to be able to get through another month and then have a baby and then be able to take care of their baby. Is it a good idea to go into a surgical procedure at that part in the pregnancy? Usually not. However, I'm trained in many, many different areas in order to be prepared for those kind of medical emergencies, and you can approach it cautiously. So if there is an emergency with your tooth, I would recommend not waiting until it's that much pain, because there are ways to prevent it. But if you are in that much pain and it took that long, don't hesitate to get taken care of. Pregnancy is something that needs to be worked around, but a doctor with a training can take care of you. Well, the one final thing I would just reiterate, that the biggest thing in pregnancy is trying to be proactive and making sure that you're getting everything checked ahead of time. And just to remind you that that's one of the factors of the many that you need to worry about when you're getting ready to have a baby. And in addition, to reiterate, you do want to make sure if you're having any pain to get it in and taken care of. You don't need to put it off if it's painful. You can get it taken care of and take care of yourself and your baby. If you've not seen one of these videos before, and if you like it, go ahead and share with someone who you think might need it. And thank you for watching. Take care.